The COVID-19 booster shot for immunocompromised people. We mentioned this a moment ago. This would mean that a third shot of the current Pfizer and Moderna vaccines could be given to certain people, but health officials are struggling to get many Americans to get their first vaccine dose. The large number of unvaccinated Americans responsible for spreading the Delta variant, with an average of 113,000 new COVID cases a day. A more than 400% increase in just the last month. CBS 46's Megan Packer is live at CDC headquarters to explain exactly what's next. And health officials, they really have their hands full with this, Megan.
Right, Rick, they do. And all the focus right now is really on people with compromised immune systems. You mentioned we expect to hear from the FDA soon. Tomorrow, the CDC's Advisory Committee on Immunizations will also be meeting to discuss boosters. But today we are learning a little bit more about who would be among the first to be authorized to get that additional dose.
As the highly contagious Delta variant of the coronavirus spreads, federal health officials say people with certain conditions would be the first to get a booster shot of the vaccine, but it still needs FDA authorization.
Certain people who are immune compromised, such as people who have had organ transplant and some cancer patients, may not have had an adequate immune response to just 2 doses of the COVID vaccine.
CDC Director Dr. Rochelle Walensky says that makes up less than 3% of the adult population in the U.S., adding the FDA is working with Pfizer and Moderna to allow an additional dose for those vulnerable people.
We understand that people are concerned. We're moving as quickly as we can with keeping safety and efficacy in mind.
Across the nation, the variant is fueling an uptick in cases. The 7-day average of daily new cases now stands at 113,000, a nearly 24% increase. Patients in Texas and Florida account for 40% of new hospitalizations, but most of those hospitalized are unvaccinated.
I'm going into my hospital to work on the COVID unit tomorrow night, and I did not get a third shot because I still feel protected by the shots that I got back in December and early January.
Here in Georgia, we'll be waiting to make our recommendations based on the CDC guidelines.
And that is Dr. Kathleen Toomey, the commissioner of the Georgia Department of Public Health. She says she is eagerly waiting to hear what we learn from the FDA and that CDC advisory committee soon. She adds that this Delta variant is like nothing she has ever seen in her 40 years in public health because of just how contagious it is. Live outside of the CDC, I'm Megan Packer, CBS 46 News.
Megan, thanks very much.